Well, thank you, Mr. Chairman. I also want to appreciate your dedication to addressing the mental health crisis and for holding our first subcommittee hearing. I know our colleagues on both sides of the aisle are interested in reauthorizing several expiring programs. We also want to look for new ways to tackle this crisis. Our witnesses today will show us how they are using existing federal programs and their own ingenuity to reshape their communities. It's been 5 years since Congress passed the Support for Patients and Community Act, the largest, most comprehensive legislative package that directs federal resources and statutory changes towards prevention, treatment, and recovery. The Support Act encouraged payers and providers to utilize alternative treatments for pain. It increased patient education and awareness across many markets, modernizing prescribing to detect and prevent fraudulent prescriptions, expanded safe disposals of unused prescription drugs, including at-home deactivation packets, and finally, it helped people get on the road to recovery through various inpatient and outpatient services. Let's talk about prevention first, where we're seeing great progress. Notably, substance use disorder and related deaths as a result of prescription opioids are decreasing because physicians and nurses are increasing patient awareness and utilizing other treatments for pain. However, Chairman Markey and I in this committee our aim is to prevent addiction by moving away from addictive medicines. The Support Act required the FDA to help address biopharmaceutical challenges in developing non-addictive pain therapies, but the agency has not successfully carried this out. We will hold the FDA accountable so patients can one day have access to innovative, non-addictive prescription drugs. On treatment, we'll hear from our witnesses on the successes of expanded access to medication-assisted treatment, telehealth, and novel coordinated care models, including certified community behavioral health clinics, or CCBHCs, which I'm a very strong advocate for. We've all witnessed too many people experiencing a mental health crisis in the wrong setting and receiving the wrong type of care. While still new, the data looks promising. People who receive care at a CCBHC spend 60% less time in jail, 72% less time in the hospital, and are much more likely to have access to a primary care provider. CCBHCs also contributed to a 41% reduction in homelessness. Congratulations, and I'll look forward to Mr. Denny's testimony to share some more of those stats again. For all the good our witnesses are providing, Congress must work to ensure that they can deliver timely access to care by addressing mental health parity issues. They need our help to eliminate unnecessary delays and denials from prior authorization, the #1 administrative burden across all clinicians and other healthcare providers. On recovery, the Support Act provided peer recovery support services and other programs that are helping people help themselves to become independent, stable, and healthy. In addition to the Support Act, I hope this committee will work with us on developing solutions to address some of the root causes of the mental health crisis in America's youth. Due to the lockdowns and resulting isolation, kids increase their reliance on social media, shifting their habits beyond a casual pastime. In fact, experts have found that overuse of social media rewires their brains to constantly seek out immediate gratification. This leads to obsessive, compulsive, and addictive behaviors. Studies have linked heavy social media use and increased risk for depression, anxiety, loneliness, self-harm, and even suicide ideation. This year, the CDC released a new survey finding that nearly 60% of young girls reported a mental health issue, with 30% seriously considering suicide, double the rate that was among boys, and up to almost 60% from a decade ago. We know social media companies are aware of this based upon their own similar findings. There's no silver bullet in solving the mental crisis. We must continue to bolster efforts on prevention, treatment, and recovery. In doing so, we should value what we measure and measure what we value. As we consider reauthoring expiring programs and exploring new ideas, they should be patient-centered, outcome-driven, cost-effective, and they must be backed by data. Mr. Chairman, thank you again for calling this hearing, and I yield back.
Thank you, Senator.